Hey, welcome everybody to the call. It's amazing how many people we're reaching out to here. 179 countries now. Our Monday calls are getting to people all over the U.S., Canada, Europe, Asia. Pretty neat. We see people from Greece, France, Germany, Spain, Brazil, Australia, Kazakhstan, Russia, Hong Kong, Japan, Philippines, Vietnam. It's crazy. We tracked the one call we did. It went over about 1,000 people in 18 countries. And again, we're recording the calls. They're archived. You can get back to them later. Today's April 27th, 2015. I'm Dr. Joe Gilson. I'm a chiropractor here in New Jersey, and we've been doing these calls for quite some time. And runners right now, I'm kind of keying on that. The weather here has been great. I've been seeing a bunch of runners coming through the office, whether it's marathon, half marathon, a lot of 5Ks here in the area. Some people actually doing a couch to 5K. They're just getting started, which is great. High school, college athletes, they're all getting a lot of wear and tear on the lower extremity, the low back, hips, pelvis, knees, ankles. It's an issue with runners. And the product that I'm using is a power strip, and it's a Class 1 medical device, FDA listed, for pain relief. So it's fantastic with my patients. They love them. It's all natural. So I always kind of start with our flagship product, the power strip. And if you've been on the calls before, I kind of always lead with germanium. It's something that it's pretty amazing. It's in the outer layer of the power strip. It's really the key to the heat that we're creating, and again, it's not just topical. It's 8 to 10 centimeters deep in the tissues, and there's a lot of things out there that you could, creams and whatever you can throw on, and most of them are, just topical analgesic, little menthol, sometimes even lidocaine. You can get some prescription stuff. A lot of times it's really covering up the symptom. It's not good for the system. And as a chiropractor, any kind of a health provider, whatever you're doing for pain relief, you're trying to solve the patient's problem. And this germanium is pretty amazing. It's in the outer layer of the power strip, and you can see on the screen there. It's got optical properties. So what's happening? I'll show you this slide here. As the heat and energy go through that power strip, we're changing it. It's refracting, it's reflecting, it's changing, and we're increasing heat and energy. We're getting dilation into the vessels, and if you know, like as light goes through a prism, that's kind of what's happening. It changes. So we're really keying in on some of that long wave heat, and again, 8 to 10 centimeters deep. So as it's getting in there, we're dilating the vessels in the affected area. So with that dilated vessel, the heat there, we're getting more blood flow. We're getting physiological, neurological changes there in the area. We're creating an environment to relieve pain. So it's fantastic. And my patients really come back to say, man, what is that? I can feel the heat in that thing. Especially when I'm exercising, I'm moving around. I'm generating some more heat. It's flowing through there, and it's creating heat deep into the tissues. And so the past few weeks, we've been talking a little bit about different issues. Started preseason baseball back in March or February, whenever it was. We're talking about pitchers and rotator cuffs and elbows, and we moved on to runners with a lower extremity. And as we're dealing with these different issues, we've got some great images here that when we were talking about the pitchers. If pitcher has an issue with the shoulder, you could see some before and after shots with these infrared images that we're taking, and we're able to prove how effective the power strip is. With that, you could see the before and after shot there. The red is increased heat, and when you're looking at the different shots here, that's a real drastic change there. You could see from before and after, and a lot of these are only 10, 15, 20 minutes a lot of times. Between before and after shots, so you can really see a big difference. And then we were talking a little bit about placement, where to put the power strip, how to use it, like where it's most effective. And we were talking one more. Let me just show you this one more. It's another infrared image. right there. And again, you can come back and stop this and replay it whenever you need to, because it is recorded. So when you start to look at the different muscle groups, there's a lot of muscle groups that affect a certain given area. So we're talking about the lower extremity, between the quad and the glutes and the hamstring. We start working into the calf area and the gastrocnemius and soleus muscle. There's a lot going on, whether it's a knee. We've gotten great results with all these different issues in the lower extremity. In terms of chiropractic with me, I'm treating the patient, chiropractically aligning the spine. But if it's any kind of a soft tissue injury, I'm using iTherm. It's just a heat treatment, basically, like a deep penetrating heat, similar to what the results we're getting with the power strips. So no matter what you're doing, you could be using ultrasound, muscle stim. It does not matter. Acupressure, acupuncture, muscle work, massage therapists, chiropractors. It's a great benefit because you can really tie it into your practice. The power strips have a great water-soluble adhesive, so the patient can wear them for 24 to 48 hours and sometimes longer. And so I've gotten really good results with different patients. I just go through a few here. There's Brad with he's had a hamstring injury, and he's a soccer goalie. So I use my whatever treatment you're using. You could do that, and then this is just an adjunct to what you're already doing. And the patients love it because it's mobile. They get to bring it with them. There's no strings attached. There's no wires, no batteries. It's excellent mobile technology, and just thinking in terms of like where you want to put the power strip, you tend to want to go. If the pain is, let's say, in the ankle, then you're going to want to place the power strip somewhere below the knee, the calf, the shin in front there, where there's some meat that you could get it onto. Because what's happening is we have an inner layer, and it's a water-soluble adhesive, which is tremendous. And then we have some ingredients that are getting into that affected area. And we're seeing some great results. We have capsaicin, Korean red ginseng, and marine phytoplankton. So we have some symmetry there because we're dilating the vessels, we're increasing heat, getting more blood supply, more blood flow. We're improving nutrition to those affected areas through that marine phytoplankton. The Korean red ginseng has a great anti-inflammatory effect, so we're getting that, and we're getting the capsaicin as kind of like a pain relief. So we really have some great things going on. And what I do with my patients, I kind of do kind of a four-step process in kind of determining where to place the power strip. And sometimes it does make a difference. If you have a better placement, you get a quicker result. And so I use the first one is really just symptom. They get the patient to kind of open up, tell you what's going on, what he's doing, maybe what sport he's playing, if it's an overuse injury, if he's exaggerating something, exacerbating, if he had a chronic injury a long time ago, and this is maybe also from that surrounding area. He's got some pain. Take a history again. And then I do some muscle testing and some trigger point work. So I really try to narrow down the specific muscle we're working with, and then using the trigger point to really fine-tune the spot. If I can find a real hot spot in the trigger point, I try to get the power strip directly over that area if at all possible. I'll show you a couple pictures here too. A couple patients that were having some calf issues lately, just to kind of recap a couple of those. Was a follow-up on a call we did last week. I mentioned a few of these guys. This is Chelsea here. And she had was a hiking injury. It's very chronic. It's over a year ago that she did it. It's kind of flared up recently. So I used my heat treatment and did the power strips. And she's actually moving. So I'm going to be sending some power strips with her, and she'll be able to use them. She's moving out of the state, so I'm not going to see her anymore. But she's had steady improvement. Whitney is another one who she just did a half of a let's see, she did the half of a half marathon, so she did like a 6.5 mile run. She did a relay, and she had some issues kind of in that tendon, the top of the foot there, those extensor tendons going down into the foot and a little bit into the shin pain. First, we thought it was like a shin splint, but it was a little lower on the joint, and that was actually one spot that worked really well. I showed you this picture. If you do have some of that pain, this is actually me with some sunburn when I was in Florida. But what I did with Whitney is I took that power strip, and right there, that's like a one power strip cut in half, one on my left and one on my right. So I did the same with her because it was in bilateral feet and ankles. So I just took that, did that same exact thing, cut it lengthwise, and I just slid it down from where you see in that picture, down about halfway down to the foot. And actually, if you point the foot, sometimes if you have a joint issue, sometimes it's tough to put the power strip over a joint. So if you have like a tennis elbow, I don't typically put the power strip over the elbow. I'll go like into the tricep, maybe into the bicep, or on the forearm, if I, pinpointing the trigger points and some of those muscle tests. But with Whitney, if you point the toe, you kind of flatten out the foot, and so you stretch the foot as far down as you can. Then you can place the strip, and then when you bend your ankle, then it's not pulling that power strip away. So that was effective. She actually wore that in the race yesterday. She wore it to train. She got good results. She was feeling great. She had no issues whatsoever, no pain during the run. So it was good for her. I just refreshed my slides there. I want to make sure we progressed through. So we'll go to the next slide here. This is Isabella. She's a runner. She's a college runner, and she also cross country, indoor, outdoor. So that's some of the problem too. Is these runners are running year round, so it becomes like a chronic problem, and they're trying to stay on the whatever kind of athlete it is, stay on the track, stay on the court, stay on the field, and they don't have any time in between. The high school kids, especially here, you go from one season to the next, there's not a lot of downtime, so they're looking to get healthy, clear up any issues they have, and stay on the court at the same time. They don't have a week or two to lay off, which would be tremendous if they could. So she had plantar fasciitis and putting a lot of miles in, and we were able to find a good spot there, right along the bottom of the foot. You could really feel that heating up, gives some more flexibility, and takes a lot of the pain away. Again, here's some infrared images, placing the power strips in the above the calf, and you could see where you're getting some of that red down below. The placement here is up into the hamstring area, and you see the red going down all the way into the ankles there almost. So you're getting some good results. And here's another one. Again, before and after, dramatic. That is about 40 minutes. See, a little more than that. That's almost 2 hours post. So you can see that. This one here, let's see if I can read that. My eyes are going on me a little bit. This is quickly. This is only about maybe it looks like 5 to 10 minutes after, from pre to post, and this is 2 hours. And patients will come back to me and say, hey, you know what? The next day I had it on. I kept it on overnight. I'll adjust them. Typical course of action with a new patient. They come in, and you may have this too, whether you're a massage therapist or whatever treatment you're doing. If you're seeing a patient Monday, Wednesday, Friday, you do your treatment on Monday. You apply the power strip. They come back on Wednesday, and they've had it on for 48 hours. And a lot of times they'll say, hey, wow, I did a workout, or I went for a walk, or whatever they did. I could feel the warmth. I could feel the heat. It felt great. You're basically getting your treatment continuing for 48 hours while they're not with you, which is tremendous. Then Wednesday, again, they come back in, get their treatment. You apply another power strip, gets them to Friday, Friday to Monday. However you're treating them, it just works great in between patients. So I found that to be terrific. One more had a good testimony here from Matt, high school runner, sophomore in high school. His last treatment, I asked his mom how he's doing. He's doing great, no pain. He's still running, using the power strips every day. and he had a hip flexor, a little quad, piriformis area issue, and his last treatment was March 30th, and he's had no pain since then. I just want to scroll back to here.